Hi, my name's Joe, and this is Susan. In this segment, we show you how simple and quick it is to enroll a family of 4 on Marketplace America. First, we would like to introduce you to Marketplace America.
Marketplace America gives you access to marketplace health insurance plans on the Federal Exchange. Our site is fully integrated with the Federal Marketplace, which allows you to access live insurance quotes in less than 1 minute. And once you find a plan you like, you can enroll in about 7 minutes.
Let's go ahead and look at how simple and quick it is to enroll a family of 4 in the health insurance plan of your choice.
This is our Marketplace America software. Remember, it's fully integrated with the Federal Marketplace. Now we're going to show you how simple it is to enroll a family of 4.
That's right. We're going to really start off with a quote again. Now, I'm going to go ahead and enter the zip code, and that's 29601. And again, immediately you've got live quotes, okay? But you need to customize this for you and your family. Now, in our scenario here, this is a little bit more in depth than our previous videos because we're actually doing a family of 4. So, Susan, we go to box 1, who needs coverage, okay?
Right.
So we've got basically the primary applicant. And how old are they?
All right, he is 45 years old.
All right, so I'm going to change that age from 45 to 35. 35 to 45 and hit enter. Now, does he smoke?
No, he's a non-smoker.
Okay, so I've got his age. He doesn't smoke. Now, you said we got a family of 4. Do they all 4 need health insurance?
Yes, they do. All 4 need insurance. We want to add one person.
All right, so we're going to add a person. Notice it automatically populates them at age 35. It's not quite right. How old is she?
She's 42 years old.
Okay, and does she smoke?
No, also a non-smoker.
All right. All right, now I'm going to got 2 children, I think, in this problem. So I'm going to add another person. And how old's the first one?
Right, the first one is 15, so you can leave that.
All right, notice the system knew that chances are the third person was going to be a child and went ahead and populated at age 15. We're going to leave it since that is actually the correct answer. Now, does the 15-year-old smoke?
No.
Thank goodness. Okay, now we're going to add another person.
Right, the last child is age 9.
Okay. And so we're going to go ahead and change that to age 9, and we're assuming that that 9-year-old doesn't smoke either. So what we've really done in box 1 is we've said, here are the people that need health insurance coverage, and we've listed them out with their ages and whether or not they smoke. None of them smoke, and we got their appropriate ages. Now we're actually ready to go ahead and go to box 2. And what do we got here?
All right, box 2 is where we're going to apply for our subsidy. We're going to look at the household size, which is 4.
All right, notice it's already changed that. Now let's say the household size was actually 6, and 2 of the people already had coverage. You could change it and come down here to 6. But in our example, everybody that lives in the household needs coverage, so we're going to leave it at actual 4. Now, how about our estimated annual income?
Right. We're going to look at household income here with both John and Mary of $65,000.
All right. So this is basically the 2 breadwinners in the house, so it's $65,000. And I'm going to hit enter there. And as soon as I hit enter, watch what happened. My box 3, that magic box, it creates a subsidy populated. And this family is going to save $434 per month. Their premium is going to be reduced by $434 per month. And if you'll notice, their lowest cost bronze plan right now is available at $203. Now, before we jump on to enrolling them and finding their plan, Susan, I noticed something. Let's go ahead and back their income up. Instead of $65,000, let's say it's $45,000, because you may run into this scenario. And when I changed that income, notice I had 2 red circles that popped up over here, both under the children. And what it says is this person appears to be eligible for Medicaid and so does not qualify for subsidized insurance. So what's going to happen is you want to leave these children here, and they'll actually get enrolled in the Medicaid system automatically, okay? But they're not going to actually be on the Marketplace health insurance plan. So understand how that works. You want to leave it that way. That's just information. But for our example, Susan, let's go ahead and change it back to $65,000.
Okay.
And as soon as we change it back to $65,000, notice our red circles are gone, our subsidy changed back. Now it's time to find the plan. Now, which plan do you think that this family would like?
Well, we like a bronze plan. We want to keep lower premiums, and we're looking for a copay plan.
All right. Well, notice my plans are already sorted. Lowest monthly payments. Okay, so this blue number should increase as we go down. And the first one I come to that has a copay, a copay is critical. Okay, you really want to find a plan with a copay because you get immediate benefits when you actually start visiting the doctor. So here it is right here, $15 copay. We can actually click on details, okay, and we can say, okay, I want to compare this plan, and then we could also come down and say, I want to find the lowest cost silver plan. I can click on compare here, and I can compare both these plans. And you don't have to go to this step, but oftentimes you want to see them side by side, because this one, the silver plan is almost twice as much as the bronze. So depending upon your financial situation, you want to pick the plan that's right for you. So let's come down here and they pick the bronze plan. They're ready to enroll in that based on $240 per month. Remember, we've got steps 1, 2, and 3. Now, it's a little bit more lengthy when you're talking about a family of 4. The part that's more lengthy is the household ones. We've got to put information on each person in there. But as far as the applicant, who are we putting information on there, Susan?
Right. We'll go ahead and do John Smith's.
Okay, that's your primary applicant. It was the first person that was listed first. Okay. And what's his address?
Street at 123 Main Street.
Go ahead and capitalize that. And if there's a house or an apartment number, apartment number or unit number, you want to put that here. And let's say it's Greenville. That's South Carolina. That's 29601. And now, as long as his street address is the same as his mailing address, you can leave that unchecked. Okay. If his mailing address was different, you check this and put the mailing address down here. All right. Now, as far as his email address, let's just say it's john@gmail.com, and his phone number is 555-1234. All right. So we've got his email address, his phone number, that's best contact information. Okay. And now his contact preference. Again, this really goes back to how do you like to receive your bills? Do you want to have your bills emailed to you, or would you like to have them mailed to you? Most people, I still think, like to get them through the regular mail. And then you want to make sure this box is checked. This enables you to apply for the lower prices and qualify for the subsidies. Now, if I'm looking at step 1, applicant information, Susan, we're done with that.
That's right. Let's go next.
So we hit next. Now what are we going to do?
All right, we're just going to complete information for John and also for the rest of the family, a little bit more detailed information.
All right, think of this as your household members. Everybody that lives in your household, you got to put information here about them. All right, so we've got John Smith. It already transferred over. We got to say he's a male, and he was born when?
June 1st, 1969.
Okay, and his Social Security number? Let's say it's that. Now, again, this reason for applying section, that's really special enrollment. You should not see this during the open enrollment. We're going to go ahead and put a date in here just so the system will let us calculate, and you'll be able to see how everything works. Okay, now his estimated annual income was?
Right, this is just John's income. His income is $40,000.
All right, so I'm going to go ahead and put $40,000 in here. I'm going to hit tab, and it wants to know where this income came from. And we're going to say it's from his job, and we're going to say it's ABC Company, and we need the employer's phone number. Okay, so we've got that information in there. Now we've got to come down here and check the boxes that actually apply to John.
Okay, John is a U.S. citizen. He's also married.
So we'll check that one.
And he is a parent of a child.
All right, he had 2 children. How about tobacco use?
Right, he's not a tobacco user.
We'll leave that blank. Full-time student,
No.
We'll leave that blank. Native American?
We'll leave that blank as
All right.
well.
So we got 3 that actually applied. Now we've got to come down and it says, how do you plan to file your taxes for 2014? And when you actually look at this, you've got multiple options. You've got married filing jointly, married filing separately, married claimed as a dependent, and married not filing taxes. Susan, which option do you think this is going to be?
Married filing jointly.
Okay. Typically, if people are married, they file married filing jointly. It's, from a tax standpoint, that's best. Now, we've completed the left side. Now we've got some questions on the right side. And this is really wanting to see if you have qualified health insurance offer from either an employer or another government organization. Now, what would this first one be?
The first one is if John was eligible for insurance through his employer. And he stated to us that he's not.
Okay, so we'll leave that blank.
And then if he has, if you have insurance coverage through an individual plan, Medicare, Medicaid, or VA.
All right, so if any of those apply, you need to check those. In this situation, none of those apply. So we've got John's information in here. We're going to come down here, and what do we get to do? We get to add a person. So we're going to go ahead and go to
Mary Smith.
Okay, that's his wife. Okay, and notice it already knew that Mary was his spouse. It had the most logical relationship there. We're going to say she's a female. And what's her date of birth?
Her date of birth is March 1, 1972.
Okay, and her Social Security number?
247.
Okay, we'll put in a dummy number. And reason for applying, again, this is special enrollment. You're going to need to put a date in here if you see this. typically during open enrollment, it should not be there. Okay. And how about Mary's annual income?
Yeah, Mary's annual income is $25,000.
Okay, so we're going to enter that. We need to know where that came from. We're going to say that was her job, and we're going to say her employer's name was XYZ Company, and that phone number is 864-123-4444. Okay. Now, again, we've got to check the boxes that apply. Which boxes apply, Susan?
Okay, she is a U.S. citizen. She's also married. She is a parent as well. And none of the others apply.
Okay, and we got a new box down here, Susan, whether or not she's pregnant, okay? Because you know what? If you're pregnant, that could actually affect your household size because you're estimating your household size. And if you're pregnant, you count as 2, not just 1. All right, so we're going to say Mary's not pregnant for this situation. And we're going to say she's married filing jointly, okay, with her spouse. And we're going to say that doesn't have a qualified offer of coverage from any of these situations. So we're really done with Mary. Okay. What do we do now?
Well, now we'll add the oldest child. So we'll add a person.
Okay.
His name is James.
Okay. Last name is Smith. And notice it already knew that James was a child. Okay. You've got a lot of different relationships under there. You need to pick the one that best suits the situation. Now we're going to say James is a male, and what's his date of birth?
1/1/1999.
And his Social Security number?
420-111111.
Okay. And again, this is a special enrollment section. I'm going to go ahead and put a date in here. And it shouldn't typically be there. Now, how about James's estimated annual income?
No, James does not have income.
He doesn't have income, okay? And you wouldn't really put that there unless James planned on filing it or was required to actually file a tax return. Okay. Now, again, we've got to check the boxes that apply.
That's correct.
He's a U.S. citizen. He's not married. He's not a parent. Doesn't use tobacco. He's a full-time student.
Full-time student.
Okay, so we're going to check that. How about Native American?
No, he's not a Native American.
How do you plan to file taxes? Well, he's single. He's not going to be filing taxes.
Okay, he's claimed as a dependent, though, so we'll check that.
Absolutely. I skipped over that one. He's single, and he's claimed as a dependent on his parents' tax return. And then he's not eligible for one of these qualified offers of coverage. All right, so we've got James' information in here. What do we got to do now?
We got to add the last child.
Adding a person's that simple. It really is.
Her name is Sarah Smith.
Okay. And notice it already knew she was a child, and we're going to say she's a female, and what's her date of birth?
4/1/2005. She's 9 years old.
Okay, and her Social Security number. We'll put all 2's in there, and we'll put our date of qualification. Okay, and as far as estimated annual income, Sarah's 9, so she doesn't have any income. You can leave that blank. She's a U.S. citizen. She's not married. She doesn't use tobacco. She is a full-time student. She's not pregnant. She's not a Native American. And she's going to be single, claimed as a dependent on somebody else's tax return, and none of these are available to her. Well, Susan, we're done with all the people. If I scroll back up, I can see that I've got person 4, and then person 3, and person 2, and person 1. So if you need to scroll back and change something, it's really simple to do. But notice I've finished step 1. I've really finished step 2. Now I'm ready to move on to step 3. So I want to come all the way back down to the bottom. When I'm ready to hit continue, I'm going to hit continue. And oops, Susan, the system is self-checking. It's that awesome. It knew that we needed something here, and it's the annual income. We actually skipped over this on purpose. This is for person 3. This was for the oldest child. So I'm going to have to come down here and put 0 as their estimated annual income. And I bet I've got the same thing. Right, I would have had the same thing for Sarah. So now I'm going to hit continue, and it's ready to go. Now I'm moved from step 1 to step 2 to my confirmation step. And really, what do they got to do here?
All they have to do is read these 5 statements and click agree to each one of those.
Okay, so read the 5 statements, click that you agree, and you're ready to submit your application. And enrolling a family of 4 is really that simple.
Now that's how simple and easy it is to enroll a family of 4 on Marketplace America.
If you missed our videos on getting a live estimate in 1 minute or less, finding the plan that's right for you, and enrolling in your plan, make sure and check those videos out if you feel you need more information. Otherwise, you're ready to choose the plan that's right for you and enroll in your Marketplace health insurance plan.